Is eye movement desensitization reprocessing therapy, or EMDR. Eye movement desensitization and reprocessing therapy is an extensively researched, effective psychotherapy method proving to help people recover from trauma and other distressing life experiences. EMDR therapy does not require talking in detail about the distressing issue. EMDR therapy, rather than focusing on changing the emotions, thoughts, or behaviours resulting from the distressing issue, allows the brain to resume its natural healing processes. EMDR therapy is designed to resolve unprocessed traumatic memories within the brain. For many clients, EMDR therapy can be completed in fewer sessions than other psychotherapies. EMDR treatment first involves assessment, stabilisation and emotional regulation techniques before active desensitization and reprocessing of memories can occur. Our brains have a natural way to recover from traumatic memories and events. This process involves communication between the amygdala, the alarm signal for stressful events, the hippocampus, which assists with learning, including memories about safety and danger, and the prefrontal cortex, which analyses and controls behaviour and emotion. While many times traumatic experiences can be managed and resolved spontaneously, they may not be processed without help. Stress responses are part of our natural fight, flight or freeze instincts. When distress from a disturbing event remains, the upsetting images, thoughts and emotions can create feelings of overwhelm, being back in that moment, or being frozen in time. EMDR therapy helps the brain process these memories and allows natural healing to resume. The experience is still remembered, but the fight, flight or freeze response from the original event is resolved. EMDR helps individuals move past the trauma, so the brain is no longer reacting as if it is still in danger. Our bodies use rapid eye movement, or REM, during our sleep to help process daily emotional experiences. When we experience a traumatic experience, this natural process of healing may not take place. Some events are so overwhelming or distressing that our memories are not stored properly and remain unprocessed. This means that the experience is more easily accessible, and certain things may trigger the traumatic memory. This causes it to replay, meaning the individual will keep reliving the distress that they experienced. The EMDR process is a therapeutic way of dealing with our feelings, emotions and body sensations that have been stuck since the trauma. Working in this way, EMDR also shifts our beliefs about ourselves and the world. EMDR involves bilateral stimulation while simultaneously recalling your traumatic incident or experience, enhancing memory processing to adaptive resolution. Bilateral stimulation can involve eye movements, tactile stimulation, for example tapping or the butterfly hug, or audio stimulation. During EMDR, you will be asked to focus your attention to the memory or presenting problem, including identifying an image or the worst part about this memory or problem, a negative belief about this memory, and also your emotions and bodily sensations linked to that moment. The purpose of EMDR is to reach a point where the memory causes less distress and allowing the memory to be stored in the long-term memory with a sense of peace. EMDR therapy helps children and adults of all ages. Therapists use EMDR therapy to address a wide range of challenges, including childhood, adult or medical trauma, complex and single event trauma or PTSD, unexplained medical symptoms, chronic illness and medical issues, self-esteem and confidence issues, OCD, sleep disturbance, migraines, depression, mood disorders, psychosis, eating disorders, anxiety disorders, disturbing memories, addiction, grief and loss, and also pain. And that is EMDR.